Dr. Crystal T. Clark is a board-certified adult psychiatrist and an associate professor of psychiatry and behavioral health sciences and a secondary academic appointment in obstetrics and gynecology. She specializes in mood and anxiety disorders. She's internationally recognized for expertise in the treatment of women's mental health broadly across the lifespan. Dr. Clark is a researcher who aims to optimize mental health treatment for all. Her research has been funded by the National Institutes of Health and the PHRMA Pharma Foundation. As someone committed to educating the next generation of psychiatrists, she serves as a director of the Advanced Training Fellowship, Women's and Perinatal Mental Health at Northwestern, and as the Associate Program Director for General Adult Psychiatry Residency Training. She is the president of the Board of Marseille of North America, an organization committed to advancing mental health care for perinatal women and their families. She is also a member of the Board of Directors for Resilience, a nonprofit organization dedicated to providing resources for sexual assault survivors. Dr. Clark received her Bachelor of Arts in Psychology from Northwestern University and her Master's of Science and Doctor of Medicine from the University of Louisville. She completed her psychiatry training at Johns Hopkins in Baltimore, Maryland. Dr. Clark has been a contributor for several media outlets, including National Public Radio, New York Times, Washington Post, Forbes, Atlantic, ABC7, CBS Chicago, and Chicago Tonight, and hopefully soon WGN. Dr. Clark.
Well, good morning, everyone, and thank you so much for having me. And thank you, Michael, for that wonderful introduction. It is a pleasure to talk about something that's passionate and dear to my heart, and that being women's mental health to a group of women. So it's a pleasure to be here. And thanks to Dr. Pedersen for leading us in that fabulous talk and really speaking about stigma and thriving. I'm going to speak somewhat about the same topics as I'm sure our next speaker will too. As it relates to reproductive psychiatry, that is what I am and one of my many areas of expertise. What does reproductive psychiatry mean? Well, reproductive psychiatry, I like to say, is where the hormones meet the mood. When your period started at 11, 12, or 13, noticing how sensitive you might become when your period was coming. That is a time in which the hormones are meeting the mood. But the hormones meet the mood throughout the lifespan of women, through pregnancy and postpartum, through infertility treatments when we're trying to get pregnant for those who don't get pregnant naturally. It also happens when we're trying to prevent pregnancy and we're taking oral contraceptives. And for the wise counsel in this virtual space, I'm sure they can speak a lot about how it changes when you reach perimenopause and postmenopause. And through all of those stages of life, I'm working with women, not only to empower them, to educate them, to advocate for them, but to help them restore their mental well-being. So today I want to talk to you about a few things, highlighting some of the stigma and disparities, but mainly addressing the reproductive lifespan and particularly the motherhood journey and how Black women are affected during that time as it relates to my second point being about postpartum depression and anxiety. During the motherhood journey, that is the most common onset of illness, mental illness, such as postpartum depression and anxiety. And then tell you more about when to seek help and leave you with some resources. So let's talk about the maternal journey, the motherhood journey, particularly as it relates to Black women. Well, in this COVID pandemic, if you haven't heard enough about all the things and the disparities happening to Black women, I am sure you are hearing more about maternal mortality. The fact that Black women in particular, are 3 times more likely to die from childbirth than their white counterparts. And that Black babies are also 3 times more likely to die than their white counterparts, 2 to 3 times. And it's not just a national US issue, but this is a global issue that we are not addressing enough. That women are dying from complications to birth, that being postpartum hemorrhage or blood clots or hypertension. But even more so, we're not talking about another thing that we are dying from, and that's maternal suicide. It being the 3rd leading cause of death in some areas, and definitely here in the United States. So what does that mean for the Black woman? Well, Too often, as Dr. Pedersen spoke about, we're not sharing our stories. Micah also brought attention to this. We're suffering in silence. We don't know enough about what it means to have mental illness and when to seek help. So let me tell you a little bit more about postpartum depression, postpartum anxiety, and other mental illnesses that we Black women are not immune to, that we also experience and can also take our lives. So postpartum depression, many of you who are listening in, I'm sure, have had children. I know many of your friends who have had children. And I wonder if you take a moment right now and just think about how you felt when you had a child, or how you observed your friend or cousin or family member, what their experience was like. Do you remember seeing postpartum blues? Do you remember them complaining about any challenges they were having? What was your experience like? Let's take a moment and think about it. Well, I will tell you that 1 in 7 and as much as 1 in 5 women experience postpartum depression or anxiety. So if you just know 5 people, one of them is likely, who has had a child, one of them is likely to have experienced postpartum depression or anxiety. And as a result, have probably needed to get help, may not have sought it, but have suffered with what that pain means. So postpartum depression, let's talk a little bit about that. Postpartum depression, the symptoms typically, as Dr. Pedersen was sharing, it's like depression at any other time in life. It's the onset of sadness for no reason often, or in the context of another trigger. The lack of interest in doing things, maybe attending to the baby is not of interest, maybe seeing friends and family. A change in sleep, and I love this one because I have so many patients, particularly my women of color and my Black women who come in and they say, well, of course I'm not sleeping, I have a baby. And yes, sleep deprivation is common with having a child, but too often we're ignoring the science that no, when the baby sleeps though, you can't sleep either. When the baby is sleeping through the night, you're still not quite sleeping well, even though, you know, you're trying really hard. You're laying in the bed, you're staring at the ceiling. What about the fatigue? My patients always tell me that too. They're like, oh, no, it's because I have children. Of course I'm tired. But the fatigue of postpartum depression is much more extreme than what we experience from having to get up, feed the baby, attend to the child, just all of the rigors of our daily lives. In worst case scenarios, we know that women will also experience decrease in self-worth, hopelessness, guilt, and often, too often, I should say, feelings that they don't even want to live anymore. And what about anxiety? Anxiety is similar, where you see that women experience more irritability. They're much more worried, excessively worried about things that they shouldn't be worried about, or that others, I would say, would not worry about as much. They might feel tension in their neck, their head, their entire body, restlessness that just won't go away. And these symptoms are more common more days than not. And that's what makes them pathological. That is what requires addressing. So when to seek help? I tell people seek help whenever you start to feel this way. If it's been more than a couple of days, more than a couple of weeks, it's okay to seek help, because if we have a respiratory infection, guess what? We're calling our doctors like, can I get a Z-Pack? Can I get some help? Are you sure this isn't a pneumonia or something? This has really been bothering me for several days now. So we should do the same for our mental health. If we are experiencing something that is bothering us and we're not sure what it is and whether it's related to childbirth or being pregnant, we should seek help and say, is this normal? Is what I'm experiencing okay? Should I be getting treatment? And that would help us to recover quicker. Too often Black women are suffering in silence. But more importantly, you should seek help if it's impairing your ability to function. You can't get your work done like you used to. You're unable to get things done in the house, unable to attend to your self-care like you should, just unable to focus like you once did. Those are also times, critical times to seek help. So with that said, I wanted to leave you with some resources. We have, of course, this wonderful panel today. We are all at Northwestern, and you can seek us out. We would love to be of help. But you can also reach out to Therapy for Black Girls, Melanin and Mental Health, and Sister Afia, who is a resource here local in Chicago. When you're seeking out for help, therapy is a great place to start, whether it's with a counselor or psychologist. Just again, going in and saying, hey, I need an evaluation. This is what I'm experiencing. You can process those emotions and work through getting rid of those negative emotions so that you can recover from what you're experiencing. You can also, in moderate to severe cases, seek out a psychiatrist. And maybe you don't know if you're having a moderate to severe case, so just go get the evaluation. If you are having a moderate to severe illness, they might recommend medication. So too often we hate that word, and we as Black women don't want to take medication. But I'm here to dispel some myths. Medication will not be addictive. We're not talking narcotics. You don't need to have benzodiazepines such as Ativan, Xanax. We're talking about medications that restore your mental wellness. You can stop them, and unfortunately, the illness might come back. You can take them and be well and not be addicted to it. And it doesn't change your brain chemistry in any negative way. I have a lot of patients that say, but isn't it gonna change my brain chemistry? Isn't it gonna do something negative to me that I'll never be able to come back from? And I remind them that we don't have a problem taking medication for diabetes, seizure disorders, a heart attack, for a respiratory infection. So why should we treat our mental health any differently? So I just want to dispel a few myths there. Finally, I close with something Dr. Pedersen has already so eloquently stated. I guess great minds think alike. I wanted to share with you guys, just highlighting our pride in being strong Black women. Too often we're saying, hey, I'm a strong Black woman. I just gotta fight through it. I gotta push through it. I can do this. And yes, you can do this, but it's okay to do this and seek self-care and get self-care. Too often we pride ourselves in suppressing, repressing, and denying our emotions, denying the pain that we're experiencing, when we really need to seek help so that we can thrive. So yes, we talked about the fact that ignoring that stress can lead to obesity, diabetes, heart attacks, stroke, all the things that bring us, that shorten our lifespan. So I encourage you today to think about strength as being the courage to seek help when you need it, the courage to keep advocating until you get it, and that strength and being a strong Black woman is also fostering physical and mental wellness for the lives that we're bringing into this world. So with that, I close and thank you.
Dr. Clark, phenomenal. Just as Dr. Pedersen, we have an amazing, amazing group of panelists. I really appreciate that. Dr. Clark brought a different perspective as far as reproductive and women, and we all go through everything that she's talking about because that's just the natural cycle of the female. So, and being a strong Black woman, yes, being a strong Black woman is being able to ask for help, strong enough and confident enough to know that you need help and support. So thank you, Dr. Clark.